Hi there, good evening. My name is Dr. Adrienne Neithardt, and I'm a reproductive endocrinologist and infertility specialist with Boston IVF, as well as with Delaware Institute for Reproductive Medicine, or DIRM, which is a Boston IVF partner clinic. Hi there. The short answer is they're probably equal. That if everything is equal, meaning the lining looks good, there's not high risk of hyperstimulation, we have a good quality embryo, implantation and pregnancy rates are probably similar with fresh versus frozen. This is not what the case was years ago. Before we were able to vitrify embryos, which is a rapid freezing technique, which is associated with much higher survival and implantation rates. Prior to that, success rates with frozen transfers were much lower, and we had a much lower survival rate when we thawed the embryos. And over the years, and now it's been well over a decade, if not closing on two, that vitrification has been widely available. It's really changed the landscape with IVF. And we find that there's a lot of advantages in doing a frozen embryo transfer. The biggest advantage is with safety, especially for the person undergoing stimulation. If you are a vigorous responder, you have high estrogen, you've got lots of eggs, and you do a transfer and you get pregnant, your risk of having ovarian hyperstimulation syndrome is very high. We know if we freeze embryos and we avoid HCG, we can almost, not completely, eliminate the risk of hyperstim, or at least decrease the severity of it. Freezing embryos allows us to do genetic testing of embryos if that's desired. And it also allows you to do a transfer in a natural or a modified natural cycle, which a lot of women prefer and may have some advantages for an ongoing pregnancy and the safety of it. So I think it's multifactorial. I don't think you have to sacrifice any, you only sacrifice time by freezing your embryos, but in certain circumstances, if everything else looks good, it is still reasonable to do a fresh transfer. In the US in general, over the past 10 to 20 years, there has been a decrease in the number of embryos that we transfer, that we're willing to transfer, and that is kind of medically acceptable to transfer. And that really corresponds to improvement in science and technology. So, the success rates that we get now with a good quality embryo, especially if it's genetically tested, but is better than we used to get when I first came out of training and we transfer 3 embryos back. So a lot of it has to do with the improvement in technology that has improved implantation rates of individual embryos. Now, when you're talking about untested embryos, you really have to know the age of the egg. So in women who are 35 and under, and I'd say even up to 37, I would argue, have excellent implantation rates if you've got a good quality embryo doing a single embryo transfer. And if you're 33 with an untested embryo, most clinics, you're going to have at least a 50% chance of getting pregnant. That's kind of average. Miscarriage rate is related to your age, probably 12 to 15%. If you put in a second embryo, you get a slight bump in the overall chance of pregnancy, but it's not huge. It's not drastic. You don't go from a 50% chance now to an 85% chance. But what you do is you go from a 2% risk of having twins from an identical twin to now 50%. And we know even in a young, healthy person, someone who's had term babies before, twins or multiples are higher risk. They're more likely to have preterm delivery, diabetes, high blood pressure, complications during pregnancy and delivery for both mom and baby. We also see that if you look at individual implantation rate of an embryo, that a single embryo has the best chance of making it to a baby rather than when you put more than one in. So we think there may be even competition between the two. Now, again, I brought up age because if someone's 43 and you have untested embryos, we know the success rate and the implantation rate is so low that it's not unreasonable in that circumstance to put more than one embryo back, especially if it's not tested. If it's tested, I would still go by one at a time. So it really depends on your age. In a perfect world, if this was all covered and nobody had to worry about how many times you do this, doing one embryo at a time would be safest for everybody. And I certainly know there's extenuating circumstances.